we should be done by now. Please commit, we should be done by now. Don't forget to write down your name, your RA or RF number. Okay, while we are waiting for others, it is important I introduce to us a very important person, a mother, a person who has trained a lot of persons in this profession. She is no other person than Dr. Cecilia Nduko. You're welcome, ma. Now just wave us, let's welcome you. You're welcome, ma. Please put your hands together for her. You're welcome, ma. Also to be recognized is a very important guest in our midst. He is no other person than Mr. Tommy Dombari. He is the head of department Pollution Control Department, River State Ministry of Environment. Please put your hands together for him. You're welcome, sir. You're welcome. We welcome you. Also, it is important I bring to the fore someone that has been running around the clock to ensure that today comes to pass. She has put all measures on ground with her team to ensure that we celebrate the World Diabetes Day. She's no other person than the chairman of the World Diabetes Day Committee. She's no other person than Dr. Adora Onwuka. Please, let's put our hands together and appreciate her. We appreciate you and your committee. You have done well. May our good God continue to bless you and give you more effort and wisdom in Jesus' name. Are we all done? Are we ready? Okay. The next on our agenda is opening remarks by the chairman of this occasion. Please put hands together as we call on Professor Z.A. Jeremiah to give us the opening remarks. Please, let's welcome you once again. Put your hands together for him. Just keep clapping until he gets to the rose room. You're welcome, sir.
BIA, if you don't answer very well, I will assume that because I'm a man. I say BIA. I welcome every one of you to this very important program. I want to recognize the keynote speaker, elder statesman in the profession, whom I have known for several years, and a very sound academic in a professor of chemical pathology. Please, can we reduce the background sound so that we can hear? A professor of chemical pathology who is going to deliver the keynote address this morning. So, welcome, sir. I also want to congratulate the management, the executive of the Association of Female Medical Laboratory Scientists of Nigeria, River State Branch, for finding me worthy to chair this event. It is not very easy to call a man to chair a female event. Maybe the reason is because in the spelling of a woman, there is a man. And anyhow you spell, even if it is women, there is men inside. And so it means that one way or the other, you can't do without us, in as much as we can also not do without you. So I want to appreciate you for, I would have rejected this invitation if it is from my wife, because it would look like a family affair. But when the chairman of the organizing committee, the local organizing committee, told me I'm going to be the chair of this event, I said, why should I chair an event that my wife is also the chair? So we are going to get 2 chairs from one family on the event. So he said, no, we are getting you to chair this event on merit. So I said, well, if that is the reason, then I gladly accept. So I want to thank the local organizing committee, the chairman of the branch, the River State branch, for finding me worthy to stand here to chair this event. That means anything I tell you this morning, you will do it. Are you ready to do it? I am now in control. If I tell you to sit down, you will sit. If I say the program is not going to start, you will not start. So if you want the program to start, you make sure you do what is right for the program to kick off. So I want to thank all of you. I want to thank the provost of this college for making this place available, and all the lecturers who have traveled and find themselves here to give the lecture. Dr. Ibegbulam is here, and the other people on the high table. And also appreciate my dear wife for putting this together. I hope you know that when you are planning a program and your wife is the head, all the bullets, it comes back to. So I've been in the planning process also, and I know that she has labored very well to make this happen. Thank you, the chairman. All right, now, this is a very serious event. We are talking about diabetes, World Diabetes Day, which happened to be on Sunday, the 14th. And this morning, we are celebrating it. What are we celebrating? The theme for this year is access to diabetes care. If not now, when? And one question I ask myself is, must you wait to have diabetes before you begin to think of access to the care? Part of what we can do to prevent is what we are doing today. The essence of celebrating the World Diabetes Day is to educate people, is to give us information that will help us to live a quality life. Whether we believe it or not, diabetes is a public health problem. And if you don't take precaution, you can never tell whether you will be the next person to suffer it. So the reason why we're here is very, very important for us to listen, for us to also, there are many people who are here to give us lectures. The keynote speaker will tell us what, access to diabetic care is all about. It will open the lectures. And the other lecturers on the sub-team will also follow to open us to so many areas we may not have known. The dietitian is here. Lifestyle and so many other things that are going to be, dished out from the lectures. So I want every one of us to take it as seriously as possible, because you may not have it again. And talking about access to diabetes care, you know that the beginning point of diabetes care is diagnosis. And every one of us here, we are at the front line in the diagnosis and care of diabetes. We are medical laboratory scientists, and we are trained, we are licensed to diagnose, and what we diagnose can also help to elicit the problem and also help in management of the patients. when you begin to take your drugs, you need to know. For those of us who are involved in the care of diabetes, you know that you can't just take your drugs anyhow. Whenever you are taking your drugs, you go back and check whether you are overtaking it or you are doing what is there. You check at every point. A diabetes must check, a diabetic patient must check the blood sugar level every time. And that is why it is important we know that so many things that are involved in the management and the care of diabetes, this is the main thing that we are gathering here. We are gathered here to get this information and go back and live a quality life. And as an adjunct to this program, we also have free screening for blood sugar. So I want to believe that by the time everyone that is present in this program, by the time you leave this place, you must have known, at least for today, what your blood sugar is. Sometimes you may think you are normal, you may think there is nothing wrong, but by screening like this, you get to know that something is getting wrong. Maybe you are the borderline, and if nothing is done, you can cross the line and get into the other side. So we just don't have to take chances of our health. We need to do everything possible to make sure that we stay healthy. And that is the reason why I want to thank the organizers of this program for making this possible. And I also want to say, as medical laboratory scientists, many times we practice behind the scene. People don't see us. Anytime a patient or somebody will tell you, go to the hospital, let the doctor check you. Actually, the doctors that are checking them, we are the doctors. But we are not seen. And I always say, we need to be seen, we need to be heard. And part of what we are doing is also to let people hear our voices. Let them know that these are the key components of the healthcare system that are responsible for our good health. We work like those in the engine room. People don't see them. Once in a while, we come out to tell people that this is what we are doing. So, and people must hear us, they must see us, they must hear us. Do you believe with me? So that is why on a regular basis, we must keep having, forum like this to tell the world that, we are at the front line of these things. We have so many world days for that, world days for that. We have to be heard, we have to be seen. So I welcome every one of you to this very important workshop. We are celebrating the World Diabetes Day, at the same time having a workshop which is being accredited, has been accredited by the Medical Laboratory Science Council of Nigeria with 2 credit units. So every participant in this program is already going home with 2 credit units. That will help you to update your license for the next year. On this note, I want to say we are good to go. We want to start, and I want you to pay attention to the lectures. Be very attentive. Jot down things that are necessary that you can go home and rehearse. And at the end of the day, we will be happy that we participated in the World Diabetes Day 2021. I want to, in my capacity as the chairman of this occasion, of this event, I want to declare this workshop open. God bless you.
That was welcome address, a chairman's remark by Professor Z.A. Jeremiah. Once again, Professor Jeremiah is a professor in hematology and blood transfusion and is also the president of the Hematology and Blood Transfusion Scientists Society of Nigeria. Once again, let's put our hands together for him. The next on our agenda is AMSIN Chairman's speech stroke goodwill message. Let's put us together as we make welcome to the stand Dr. Jane Obi Thomas. She is the chairman of Association of Medical Laboratory Scientists of Nigeria, River State branch. You're welcome.
Thank you. BIA, intelligent, adorable. BIA, intelligent, adorable. I want it resounding. BIA, beautiful, intelligent, adorable. Yes, I can see beautiful faces around here. And I thank God for BIAs. Mr. Chairman, sir, Professor Jeremiah, please permit me to adopt the existing protocol, please. First of all, before I start, I want to welcome in a very special way my teacher, my mentor, who has traveled all the way to Port Harcourt to grace this occasion. I have listened many times to Professor NNAMAH, and I bet you today you will not regret it. You're welcome, sir. And sir, before you leave, sir, I want you to taste the soup we call Edikaiko here. And I'm very sure the chairman, she knows the very good spot where, yes. Even the prof can take care of that as well. You're very welcome, sir. I recognize all the members of the high table. But before I continue, I want to specially welcome the chairman NOAP, River State, Mr. Oye Otaruku. You're welcome, sir. And the AMSIN chairman, Guild, I can see him here. Guild, Mr. Mark. You're welcome, sir. You're very welcome, sir. I want to also appreciate our elders here. Dr. Don Onguli, you're welcome, sir. Mr. Martin Oyekam, I can recognize you. You're welcome, sir. Thank you very much for being here. I want to appreciate the LOC, the team, the beautiful team being headed by Dr. Adora Omoka. I tell you, this topic they have chosen is very apt. A friend of mine, a medic, he said, if you have BP, high blood pressure, for 10 years, over 10 years, be expecting diabetes. And I tell you, many young women, many young ladies and men, they are having diabetes today. And how can we conquer it? Living healthy lifestyle. I tell you. So it's very apt. I congratulate you for this topic. And I'm sure it will do well to help all of us. I want to thank the management of the school, the provost, Professor Lerum, for hosting us. And all the members of the staff that are our colleagues, I want to appreciate you all. My job is simple here. On behalf of all the members of Association of Medical Laboratory Scientists, River State Branch, I wish you a fruitful deliberation in this workshop. Thank you very much, and God bless you.
That was a brief and wonderful message by the chairman, Association of Medical Laboratory Scientists of Nigeria, River State branch. Once again, let's put our hands together for her. Distinguished guests, ladies and gentlemen, I want to inform us that when in a place where you have too many big fish, you will tend to experience some challenges. While the fan is blowing directly, I'm still sweating because it looks like I'm not recognizing everyone completely. It is important, if your hands are not too busy, please join me as we recognize the presence of Dr. Mrs. Evelyn Eze. Please put your hands together for her. You're welcome, ma'am. You're welcome. Please, to be seated on the high table is my own father, elder brother, and a senior colleague whom I have so much regards for and respect. Is no other person than the chairman of NOAB, Mr. Oye Jonathan. Please, you're welcome, sir. Please join them at the high table. The Igbos would describe you as Odogu. Okay, he said he's a comrade. He doesn't want to sit with them on the high table. Let's call on the representative of the NLC chairperson, Obi Erekosima, to give us the goodwill message. Let's put our hands together as we welcome her. While she's coming, let's also recognize the presence of Dr. Gospel Ajuru. You're welcome, sir. We recognize you. You're welcome. Also, let's recognize Dr. Mark Diala. Dr. Mark Diala is the chairman of Guilds. Please, you're welcome. We recognize you. He's a very fine man. I respect you, sir. You're welcome.
BIA. 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 I want to constituency now. When I say women are great, you say no controversy. Women are great. Women are great. Women are great. That's number one. Now I want to take it to my solidarity song. Can we all rise, please? When the union inspiration to the workers not shall run, there can be no power greater anywhere beneath the sun. Yet one falls on earth is weaker than the feeble strength of one. For the union makes us strong. Solidarity. 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 Union makes us strong. Victory. Victory. There is victory for us in the struggle. Our members, there is victory forward. Ever backward, never. In the struggle for our members, there is victory. He's a little. He's a little. A Luther until the victory. Thank you. Please sit down. Thank you, and thank you very much. BIA. I'm back to your constituency now. Thank you very much. On behalf of the Mother of the Congress, Comrade Chief Beatrice Igwe Tubo, want the Association of Medical Laboratory Scientists of Nigeria for this epoch event by celebrating 100 years of the continuous celebration of Diabetes Day. Thank you, and may God bless each and every one of you here. I want us to remember one thing, that in every home there is a diabetic patient. In every home. In as much as I heard from the chairman, in short, before I say any other thing, I want to thank the chairman of this great event, Professor Jeremiah. We are no longer behind every successful man, beside, side by side, beside every successful man, there is a woman. It's not just a woman, there is a capacity woman. That when you have a capacity woman, you will see a capacity man. He comes out in the public and celebrates his wife. That is what the man has done for us today. And that's why wherever I find myself, I always tell women, it is not I want to marry. Be a capacity force to support the man. So that when he comes out to speak, my wife is the chairman, so this is a family business. It's only when you have a capacity woman that commands, and she commands respect wherever she finds herself. That is where you will hear the man say, "That is my wife." And you can see he's a prof. She's a doc. Women, improve yourself. I say it anywhere you go to. Gone at the MC was saying something about the yesterday and the today. The today woman is a capacity woman. The today's woman is a force. The today woman have moved out of the kitchen. She is no longer in the bedroom. We are in the parlor. You no longer sit behind us. We sit with you to discuss our issues. And they the front seat. If you educate a woman, you educate a nation. I want to thank every one of you for this great move. I think while seated there, I was like, maybe I should look at next year where we invite Madam, and I will write to our committee to please come and talk to women in the civil service. You know, with the economic meltdown, with the current situation of, are we retrogressing or we are moving forward? Either way you look at it, there is high rise of depression, hunger in the land. And it has resulted to people eating big basin of gari and small soup. We don't care what we eat in the name of, instead of nothing available, let me make good use of the available. So a lot of us no longer watch what we eat. For us to move out of diabetes, we need to change our lifestyle. And for us to change our lifestyle, things are so expensive. So what do those of you in the medical area, what do you think? Those of us in the other side that are civil servants, what do we need to do? Everybody here belongs to the medical field. I was expecting this invitation to spread along the NS, not just inviting my boss, but writing to us that you need your women to talk to us, because the woman is the builder of the home. She's the first teacher of every child. The man goes to work, the woman does the cooking. And when she goes to the market, the money is not enough. She begins to buy the available, what the money can buy, and bring to the house. So we begin to eat junks in the name of we're eating food. And we begin to order you people in the lab, in the clinic, doctor, my BP is high. And doctor, my urine is foaming. At least when they gave me this pre-test, I know some things. I said, I was just telling Chama, I said, at least I can answer some, but I don't have a number. Oh. She said, no worry now. I said, no problem. Because why? These are things that as we walk in the office, we hear our colleagues complain. Our sight. I'm from a family, my granddad died of diabetes. He's a diabetic and BP patient. My grandmom, same thing. My father died of it. And somebody who is not in the medical field, common sense begins to tell me that there's every possibility of hereditary. I could remember in my second pregnancy, they detected it. And immediately I said, no, I can't be a victim of it. And I immediately changed my lifestyle. But I know in my father's house, almost everybody is a victim of diabetes. And because I've changed my lifestyle, I try to introduce it to them. If you come to my house, you meet my uncle that is down with diabetes. He was discharged 2 weeks ago. And I try to manage him. From my relationship with people in the medical area, from my exposure with the internet and the social media, I begin to remove and add some things, what to do, what not to do, what you expected, so that you can manage it. I think next year when you're having this kind of celebration, please do well to extend your hands of fellowship to people outside the medical field, because we are the people that need it. Everybody here knows what it is and what needs to be done. But those of us that are not part of it, we need it because we go home. Even these days, I understand kids come down with diabetes. In the past, we used to see it as a big man sickness, and it's meant for the elderly. But these days, every sickness cuts across every age and all of that. I want to congratulate you people, and I wish you all the best. Women are great. Women are great. Let me give you one other labor song again that you will not laugh. My daddy is a garden boy. My daddy is a garden boy. My mommy is a kitchen girl. I am a unionist. Thank you very much.
It's one that everybody is taking us to their constituency. Do you want me to also take you to my MC constituency? Okay, our own constituency is that BIA. They say the man is the head of the family, isn't it? And the woman is the neck of the family. Waiting carry head. Waiting carry head. That is why you are all important. Put your hands together for yourself. The time we've been waiting for, it's here. Let's make welcome the keynote speaker to explore and tell us about access to diabetes care. If not now, when? Together, let's put hands together as we invite Professor NNAMAH to deliver on this topic. Put your hands together until he comes to